Hi, I'm Dr. Laukkanen, and I'm going to talk about what it's like to go through a course of chest wall radiation. And it's for people who've had a mastectomy and are looking at chest wall radiation as a next step in their care. This video follows on one about getting ready for such treatment. On your first day in the treatment room, you'll spend about 45 minutes, and after that, it'll be about half an hour. And each region takes only a few minutes to treat. So most of the time is spent by the technical staff making sure that everything is set up just so. And when the treatment machine is on, you feel nothing, no different than an ordinary x-ray from the patient experience point of view. So the treatments are daily, 5 days a week. And a usual schedule for a chest wall, especially if it's combined with adjacent lymph glands, is 16 visits, which takes a little bit more than 3 weeks. Sometimes it's a good idea to add a little extra radiation to a particular area, and in such cases, 4 or 5 additional treatment days can be added. So imagine a 3 week and a bit course of treatment. Let's look at how the side effects progress. Little in the first week, a little bit more in the second week, yet more in the third week. And when the treatment ends, the side effects are close to peaking, but sometimes they can either stay the same or get a little bit more in the week or so that follows treatment. Then after that, just as they gradually became more obvious, they gradually get better over about 4 weeks. So a little more, then settling, and on average, by about 4 weeks after the treatment, things are fairly nicely settled. So the general idea is that the side effects appear during the treatment, they peak at the end or not long after, and they gradually settle over about the same period of time that they developed. And of course, every person's experience is unique. Some are faster, some are slower, some have more obvious side effects, some have less. So let's look at those side effects now. Uh, the noticeable changes, how the area looks and feels. And so there's a range of visible skin changes that are like a sunburn, warmth, and with it, the tissues can either feel a little bit more full or be more tender. Itching and tenderness are common and usually quite manageable. And for a few people, they can be meaningfully troublesome. The visible changes are color effects. The skin can be pink or red or more tanned. Uh, it may have peeling, usually dry peeling like a sunburn. And on some occasions, the peeling can progress to the moist stage, and there's a special care plan for that. And where there are skin folds on the chest wall, those areas are more vulnerable. And here we're thinking about friction. Uh, Especially in the area where the upper part of the arm on its inner side rubs the chest wall when you're moving around, that can be a more of a problem zone. Very rarely, after a person's had their mastectomy surgery and it's settled down, they can be left with a little bit of extra fluid under the surface, and it's in the cavity where the breast used to be. And sometimes, if there's a meaningful amount of that and there's any pressure during the radiation treatment, that might drain through the skin at usually through the mastectomy incision. It's not a big issue if it happens. It's just a matter of looking after it and making sure that no infection arises. As I say, that's a very rare event, as something can be seen with after treatment. These pictures just show some examples of skin changes. You can see the brown pigmented tanned look in the treated skin compared with the skin that has had no treatment. Here's another example where the skin that is treated has more of a red color. And in that particular area where the lettering is, that's an area where the arm can come into contact, and that's an area more vulnerable because of the friction effects not being repaired during the radiation. So on the left, we see minor changes where the skin is red and intact, and on the right, we see a more brisk skin change or in fact, a bit of surface layer that's been affected by the treatment has come off. And of course, the deep layers of skin gradually heal that up, but that's what takes a number of weeks to happen. So, as I mentioned, those side effects on the skin settle over a few weeks, although even for months or even longer, there can be little changes in pigment, or the skin can just look a bit different, and the possibility, especially if extra radiation has been added, for little tiny blood vessels to be visible near the skin surface. A bit of tenderness and fullness of the chest wall can linger for a number of months, but it's usually mild, and the area may feel more firm. Now, with respect to feeling tired during and after the treatment, that depends on the person. If a person's had, for example, many months of chemotherapy treatments prior to the radiation, naturally they will feel tired. Or if they're exceptionally busy and trying to carry out the radiation and do a lot of other activities, they can feel tired. So it's important to be as much of a person of leisure as you can during the treatment. What about uncommon and delayed side effects? And these would be caused by the fact that radiation causes very small amounts of scar tissue to form, but it can be over a broad area, and those little bits of scar tissue can uh, cause tissues to be a bit more firm, and it can cause small blood vessels to perhaps not have as good a flow. And so when we think of those areas that can be affected, think of all the areas in the treatment area of the chest wall. There's the skin, there's the soft tissue under the skin, there's the rib cage itself, and under the rib cage, of course, is a bit of lung, and on the left side, the heart, and sometimes can be very close to the edge of the chest wall. And these techniques, no matter how artfully they're carried out, they do require the coverage of a small amount of lung. And although the heart is maximally avoided, a very low radiation dose can be delivered to the heart as well. So let's look at the uncommon delayed risks associated with the treatment. So if the tissues overall are more sensitive to radiation than a normal person's, that scar tissue formation could be greater. The tissues become more rigid, and with that, they could be more vulnerable to trauma or infection. But this is an exceptionally rare event, and I have not seen that in chest wall radiation through a practice lifetime. I have seen it with the breast, but not with the chest wall. Uh, the Ribs, in theory, are more predisposed to thinning of the bone or osteoporosis. But if a person has a generally proactive, that is, a preventive stance to osteoporosis, it would be not expected that the radiation treatment by itself would induce sufficient osteoporosis to, for example, cause a rib to fracture and cause symptoms from that. And the word to the wise, of course, is as the years go by, to have bone density checks and to live a bone healthy lifestyle, have low bone density treated. Next, the lung, which is underneath, the little air sacs can respond to radiation, in theory, with inflammation. Most of the time, the lung underneath doesn't care. But if it did, and inflammation were to arise, a person could get a cough from that, perhaps feel a bit of restriction from their breathing. That is called radiation pneumonitis. It's treatable. It occurs with a chest wall treatment. It could, depending on how close you look for it, even 1 or 2 in 100. Uh, in some series, much less. Importantly, it can be treated with anti-inflammatory medications if it arises. On the left side is the heart, and again, in theory, radiation exposure of the heart could impact the heart blood vessels. There's a lot of argument about is that a significant effect or not. And the likelihood is that if a person has other factors, that the radiation can then add to them. But in a perfectly healthy heart, radiation by itself is not likely to cause an effect that is detectable when modern radiation methods are used. A couple of other things to think about. Any radiation can potentially cause a cancer especially in the middle-aged and older. Uh, except in smokers, that risk is so low as not to be measurable. There's always a chance of a treatment error causing more radiation to be given than prescribed, but that would be less than 1 in 100,000 with the checks and balances and error control on these machines. Just to go back to the lung for a moment, this picture shows the area of the chest wall that would be covered with a radiation beam in the purple. And you can see when you follow along where there's that junction between that darker and the white area of the chest wall, a zone where the little purple arrows point, where there's this kind of fuzzy area. That's radiation having caused inflammation that has then progressed to fibrosis or a bit of scar tissue. Uh, this person who had this wasn't even aware of it. But as I say, this is that radiation fibrosis or pneumonitis in its early phase that can be treated if it does arise. So a final point is that I mentioned that the average person has 16 treatments, and occasionally it can be a good idea to add a greater amount of radiation to a smaller area, and especially an area at greater risk because of the nature of the cancer. And if that is treated, that local area would be potentially vulnerable to more of the effects that I've described in terms of the skin, especially. So thanks very much for your attention. So just to summarize, chest wall radiation can cause skin bother to everybody who has it and tenderness for some. But favorably, very few people are likely to experience any major delayed radiation side effects, the side effects that are caused by radiation creating small amounts of scar tissue or impacting tiny blood vessels. But rarely these things can happen. It's important to remember that the chest wall treatment is usually combined with treatment of the nearby lymph nodes, and there's a separate video on that. And lastly, while the radiation dose to the skin is kept at a moderate level with standard chest wall treatment, there are occasions where it's desirable to raise the skin dose to the max. For example, with inflammatory breast cancer, there's a separate video on that. And those people who need to have the skin dose raised to the maximum are going to have more noticeable treatment side effects. Thanks a lot for your time.